I'm Talia Swartz, and in 5 minutes, I'm going to give you tips on giving effective feedback through microcoaching. Have you ever found that you did not have enough time in the day? Has it ever happened that you've observed something that went horribly wrong and you didn't feel like you had the tools to be able to provide appropriate feedback? I'm going to teach you some micro skills that you can use on the fly that take almost no time and provide effective quality feedback. So here's an example of feedback gone wrong.
So in summary, this is an 85-year-old male with a history of coronary artery disease, heart failure with an ejection fraction of 35%, diabetes and hypertension, who presents with chest pain and shortness of breath. I think the differential diagnosis includes Wegener's granulomatosis, pulmonary embolism, and costochondritis. I know the patient said that he had a headache, so I read a really interesting case report in J Laryngology Otology in 2012 about a patient with Wegener's granulomatosis who presented with meningitis. I'm not sure if the headache is the most important part of the presentation here, but in that particular case report they used an LP to confirm the diagnosis of Wegener's. And if we're considering other things in differential, like costochondritis and the pulmonary embolism, I'd be interested to see what the chest x-ray and the EKG show in order to give us some more information.
All right. Is it okay for me to give you some feedback?
Okay.
I think you did a really thorough job. Obviously, you worked really hard on this presentation.
Thanks.
But your differential diagnosis could use some work.
Okay.
But it's been a pleasure working with you. I mean, you obviously work really hard.
Okay, thanks.
What did you notice? Was that feedback? It might have been, but it wasn't effective feedback. So we're going to talk about how to give effective feedback in a really short period of time. Effective feedback is also known as coaching, and the goal is aiming for consistent, high-quality performance. You may be familiar with the traditional feedback sandwich, which goes like this. On the whole, things are fine, but you suck at this, but overall it was really good. And this is the feedback sandwich that we saw in the first example. So I'm going to show you the new feedback sandwich. That is one that is learner-centered, which involves active and interactive participation. It avoids assumptions or judgment, and it promotes reflection. In this case, the sandwich is ask, tell, ask. So initially, you ask the learner to do a self-assessment to gauge where they are. You tell them the things that you've observed, and then you ask them for their feedback. And this is much more active, it is much less threatening, and it's much more successful. Here's a better example of where feedback is given using this ask, tell, ask approach. See what you think.
I'd really like your feedback on how he did and how he could maybe do better.
Sure, I'll be happy to. Would you want to do it now or afternoon conference?
Sure, now is good.
Great. So let's talk about how you think your presentation went.
Well, I was really trying not to just read off my notes like we were talking about me doing before.
Yeah, and I see that you've been working a lot on not reading off your paper. You were doing it this time, but less than before, which is an improvement. I also noticed that you spent a lot of time learning about Wegener's, but didn't comment as much as some of the other cardiac etiologies or this particular patient's risk factors. Is there a reason that you chose to focus on Wegener's, which is a not very common diagnosis?
I read a lot about what could cause headache and the shortness of breath. I tried to incorporate the case report into my presentation, but I also didn't want to make sure I missed the other important diagnoses. Do you think I was emphasizing something that's too much of a zebra?
It's always good to think about the zebras to be sure that you're not missing anything. You want to be careful not to miss the most common diagnosis and the life-threatening diseases. The fact that this patient had a known history of cardiac disease and has had prior similar symptoms in the past is key. Try to consider the chief complaint in the context of the patient's history and risk factors.
I see. I guess I was trying to put everything together and didn't think enough about the most common causes. Do you think it'd be better if I had a differential that focused more on cardiac diagnoses?
Yes, it certainly sounds as though fluid overload from congestive heart failure is a high likelihood. If you like, you can revise your assessment and plan. I will be happy to listen and give you some pointers to work on a plan from there. Does that sound okay?
That sounds great.
So the next time you see something that you think can be improved, stop and take 5 minutes and use ask, tell, ask, and see how your learner can improve. Good luck!